COVID-19 boosters versus the vaccine. What's the difference? In this episode, we answer that question.
Hi, and thanks for streaming today's episode of Vax Matters. We're so glad you're here. Our selection of questions today addresses the use of COVID-19 boosters, as Dr. Jennifer Avegno of LSU Health in New Orleans lends her expertise to our conversation. Thank you for being our guest, Doctor. Good morning to you.
Good morning. Thank you for having me.
It is our pleasure. And I guess we just need to start with the simplest and probably your most asked question. What exactly is a booster?
Well, a booster is, to put it one way, a refresher for your immune system. Your immune system, when it is faced with a virus or when it is given a vaccine, is learning what pathogen to look out for, what it looks like, what receptors it might attach to, and to figure out a way to fight it. So with some vaccines that you might remember from childhood, it takes a few shots to get your body really used to recognizing what a particular pathogen might be. And for some viruses, your body remembers it for the rest of your life. For a virus like coronavirus and others that we can talk about, even if you've had the virus or you've gotten a primary series, your body sometimes either doesn't remember for as long what that virus looks like, or the virus itself changes in such a way that your body might not recognize it unless it had that refresher course. And so that's just what a booster is. It's intended, as is in the name, to boost your immune system so that it can be as prepared as possible for whatever strain of the virus you encounter.
That's about one of the best explanations about something like that I've ever heard.
And I love it when you said it's a refresher. That's something we all can remember and we can all identify with.
Right. Like I like to think of it as school, right? We go to school, we learn our multiplication tables, and we remember those for the rest of our life.
Sort of.
If you were to ask me, right. So that might be one of your early childhood vaccines. But if you were to ask me right now to do trigonometry, I would need a little bit of a refresher because that's not something that I've retained. And so I would need a booster for trigonometry, just like I might need a booster for COVID or the flu.
Understandable.
So listen, what is the difference between a booster and an additional shot?
In some ways, it depends on the virus that you're talking about. Let's take tetanus. Everybody knows that if you get a cut, you want to get a tetanus shot, right? And you get them as a child, but every 10 years or so, you need a booster. In that case, it's the same formulation of the vaccine. It's just because tetanus doesn't really change very much. Mm-hmm. When you're talking about something like COVID or the flu, what the goal of the booster is to update that vaccine coverage for whatever strain of the virus is circulating. We know, for example, with the flu, that every year there tends to be a predominant strain across the world. And some years it's very similar to the year before. Some years it's completely different from the year before. And so that's why we get a yearly vaccine for the flu, because we're trying to match our protection with the strain that's circulating. Same with COVID, except it seems that COVID, like many other coronaviruses, change even more rapidly than the flu does. If you think about all of the different major strains of COVID we've had the original, we've had Alpha, Beta, Delta, Omicron, and a whole bunch of other ones in between. It's changing very rapidly. And again, sometimes when the coronavirus changes, it's something that's fairly recognizable to your immune system. But sometimes, like the Delta variant, for example, it's a pretty big shift and your immune system just might not be able to keep up. So the vaccine is trying to match whatever the dominant strain is at that time. And as you can imagine, that's tricky. If it's changing very quickly, it's not like you can just make a new vaccine in a couple of days. And so it's sort of a race between us and the virus to figure out who's going to be on top.
And when you stop and think about it, our immune system, we've talked about it on this podcast before, how remarkable it is that our body does what it does without us even being aware of it. You know, we need doctors like you. We need the health professionals to bring us back into focus, to let us know, hey, yeah, you're doing a really good job, but that's why you need a shot, or that's why you need boosters to keep your body moving at the ultimate capacity that it can.
Yeah, it is amazing. And our body, it's not just one type of defense. It's not just one way to recognize an invader, if you will. There are short-term memory cells that are really quick to recognize something, but then your body has these longer term defenses that, maybe even if it's years later. And in the case of the flu, what we see sometimes is that if you're an adult, but you got infected with a particular strain as a child, your body still has some memory of that. And so if you see it again as an adult, it's going to fight it off. So it's the layers of immunity that we have inherently are amazing. And vaccines are just capitalizing on what we already have.
That's interesting. You've spoken to why we need boosters. Let's talk about who's most eligible for the COVID-19 booster.
Well, right now for the bivalent booster, it's pretty much anyone except for very young children, which is great. I know in the beginning of COVID, because there was a scarcity of supply, we were really targeting individuals that were at high risk of complications. And then every place sort of rolled it out differently, who got it next. But the nice thing about the new bivalent booster is that it is readily available for almost everyone. And it's the only booster available. So if you walk into your doctor's office or your drugstore and you say, I'm ready for my COVID booster, there's only one they're going to give you. And that's because it is the one that is matched not only to the very original strain, but also to the strains that have been circulating pretty widely for the last 4 to 6 months.
Let me ask, so if someone is wondering when should they get it, what would you say?
I would say get it now.
Okay.
There's a lot of good reasons for that. What we've seen over the last 3 years, and this is no surprise, is that we have surges of COVID, whatever variant it is, in the wintertime. And that makes sense, at least in the wintertime in the Northern Hemisphere, because it gets colder. People are inside in more crowded spaces, and it's much easier to transmit respiratory viruses that way. With holidays coming up, you want to give yourself that extra layer of protection if you're going to be traveling, if you're going to be with family members, particularly those who are immunocompromised. So now is absolutely the time. We do know that once you get a booster, it does take a couple of weeks for it to be at its maximum effectiveness. And boosters seem to have really good protection for at least several months afterwards. So getting it now will really carry you through that winter holiday season. My whole family has gotten it so that we can be ready for the holidays. And there's no time, really no reason to wait.
Just because I'm a little curious here, and just to maybe review about maybe some terminology, when we talk about the shots, the vaccines, the boosters. So with this, doctor, we began, when was it? My days, with COVID and everything, we had the series of the initial vaccine, and then came the boosters, correct? Is that right?
Yes, that's correct.
Okay. So what would happen, just throwing it out there, if somebody hasn't had even the first vaccine? It's never too late, I'm assuming, to start from square one to do the vaccines, then the boosters. Is that right?
That's right. You definitely want to get that initial vaccine series. That's sort of the foundation that everything else is based on. And so if you haven't had those, no reason not to get those. What the booster is just sort of an updated version, but you really do want to have that base protection first before you get the booster.
So I've had the vaccine, the two, the 1-2, and then the 2 boosters, then eligible for this 3rd booster. But I've talked to friends saying, oh my gosh, I'm going for my 5th booster now. I thought, what in the heck are you talking about? See, I know it's semantics, but people get it confused in their brains, in their minds about all these shots.
Yeah, it's very confusing. And I think it's been a real challenge for public health leadership to communicate, because we have to be honest. We are learning about this virus as we go. This is not a well-established virus. Think about what it must have been like, when they started flu vaccines. They didn't really know what they were dealing with either. And it took many, many years before they were able to settle in this yearly pattern of boosters that, for the most part, has worked pretty well to prevent major flu pandemics like we saw in the early 1900s. But with coronavirus, it's changing so quickly, and the burden to the world has been so high that the desire to protect as much as possible led us to have several boosters whenever there was a major change. What I think we're seeing now, as the acute part of the pandemic starts to wane, is that we're going to settle into a pattern like flu, where a yearly booster will likely be the best form of protection broadly. That doesn't mean that our high risk, vulnerable, immunocompromised, elderly patients might not benefit from maybe more frequent boosters down the line, because their immune systems need the most help. But what I think we're going to see is a much more regular cadence. And in that case, I think it's going to be a lot easier to message, just like we do with flu. Hey, winter's coming, time for your yearly boosters. That's flu and that's coronavirus. Understanding that there are a lot of viruses that we deal with in the winter, but these are the only ones that we have really good vaccines for. And so we just kind of want to get people more in that mindset of yearly. But it has been confusing. I completely agree with you.
Yeah. Has some of the normalcy that has returned impacted people's view of COVID-19 right now? People are socializing more and more. Public events are happening here in Baton Rouge. We are getting together again. So has that taken people away from some of the attention to getting vaccinated and staying ahead?
Yeah, I think there's just a lot of fatigue. I think that people are just really tired of hearing about COVID and viruses. And look, I don't blame them. But I think that if we want to keep it this way, there's some minimum things we need to do, and one of those is getting both your COVID and your flu boosters, and then really, really paying attention to how you're feeling. Interestingly, what we're seeing right now, particularly in our young people, is all sorts of circulating respiratory viruses, the things like RSV and adenovirus that we also normally see in the winter, but we're seeing them a lot earlier because, just as you said, everybody is going out and spreading all the things that they really hadn't been spreading quite as much for the last couple of years. So on top of the threat of a flu season, and we know that the flu season in the Southern Hemisphere, which happened in our summer, was really bad. So we worry that we're in for another bad flu season. If we get another COVID surge, plus high rates of all these other respiratory viruses, that puts the same strain on our hospitals that we saw at the height of Delta and Omicron. And I don't think any of us really want to go back to that. So as we're opening up, as we're doing more things, I'm certainly so grateful to be able to do more things. But I think we just need to take the minimum steps to keep it that way.
And I think, as Clay said, we're more aware of what has happened and what could happen. I mean, before 2020, who would have ever dreamt, even in a science fiction novel, about a worldwide pandemic shutting down the world for as long as it did? But thank goodness for the brilliant minds of the scientists and the doctors and the vaccines. So my question, Dr. Avegno, is that I received a Moderna. Vaccine is my primary series, and there was Moderna, there was Pfizer. So for my boosters, I have stayed with Moderna. Is that always going to have to be the case from here on out, or will it be just a booster for COVID-19 or for whatever.
No, and you can mix and match now.
You can. Okay, I didn't know that.
Did my primary series Pfizer, and then because I had read the studies about mixing and matching, and there's really no difference between switching or staying, with your original strain, and maybe there might even be a little benefit to doing one over the other. So I went to a Moderna for the first booster, and then I just did a Pfizer for the second. So no, that's the nice thing, is that really they're all the same technology. Basically, they're all the same kind of vaccine. And so they're all going to be protective. Now, I imagine that both Pfizer and Moderna will continue to make their own sort of brand, but that's just that's the rest of medicine, right? You can have a antihypertensive drug that has a generic, but has 5 different brands. And it's all exactly the same drug.
You referenced maybe this becoming a yearly thing that we have to do. Is that something you see on the horizon for real, that we may have to get these shots every year?
I do. I think that is the way that the scientists are going. Remember what, let's think about the flu pandemic in 1918, right? Which was even worse in terms of the number of deaths that COVID was. We didn't start yearly flu vaccinations immediately, but since we haven't seen a big pandemic like that. Now, flu is still very prevalent. Flu can be very deadly. In bad flu years in the US, we can, over 50,000 people can die. That's a tremendous number. But what we don't see are these major, global outbreaks. So I think that's the goal with COVID. We know that COVID will likely always be with us. Unfortunately, we still have 350 plus people a day who are dying from COVID. Wow. I think we will always, like flu, have some COVID deaths, but the goal of having that yearly protection is so we do not have another major global pandemic, because I don't think anybody wants to live through that twice in a lifetime.
Well, and again, it gets to the point that I believe some people get almost nonchalant about it, thinking, well, it happened, it's never going to happen again, or that I did get my initial vaccine, and I'll just every now and again get my booster. I would imagine it's pretty important to keep on a schedule, just like when we were children, to have the schedule of shots and boosters that you have. And even as an adult, what is an ounce of prevention worth a pound of cure, or something like that? I might have that mixed up.
But I run into this all the time. I don't get a flu shot because I've never gotten the flu.
Yes.
And what I tell people is I am religious about the flu shot, because about 25 years ago, I got the flu. And once you get it, you never, ever, ever want to get it again, because it's so miserable. I was lucky. I just was sort of miserable for 10 days and I was fine. Yeah. I didn't have any complications. I didn't develop a pneumonia. I didn't die from the flu. But you shouldn't, I don't want others to go through what I went through to learn that lesson. So I say, you're pretty lucky if you haven't gotten the flu yet. But one day you're going to, and you're really going to wish you had gotten that flu shot.
And do you really want to leave that to chance? You don't, knowing what we know now and everything that's out there to help us. That's almost just unbelievable. But as human beings, you can't tell us sometimes what we need to do. Doggone it, I'm going to do it, because like you said, I've never gotten the flu. I don't need to worry about this. That's a shame. Yeah. When we were talking about boosters, we automatically assume, doctor, that we're talking about COVID-19. But from what I understand and in the research, that's not the only vaccine that would require a booster. Can you talk about some of the other vaccines that require boosters?
Yeah, up until now, or up until COVID, I would have said that the most common booster that I give as an emergency physician is a tetanus booster. We all got a tetanus series when we were a kid, and the last in that series you get at about age 11. Every 5 to 10 years, though, you need that tetanus updated, and it's not just tetanus; it's tetanus, generally tetanus, diphtheria, and pertussis. And people say, what's diphtheria? I've never had diphtheria. Exactly, because you've been vaccinated for it. Pertussis, though, is a very interesting disease that you don't think about, But what we're finding is that immunity to it wanes over the years. It generally causes respiratory disease. And the danger of not getting a pertussis booster is that even if you're a healthy adult, if you get pertussis, which you often can't really tell what it is, it's just a bad cough and you kind of feel bad. If you give it to a young child who has not had their primary series yet, or an elderly person who has a weakened immune system, they can have very severe cases and even die. So getting that booster that you're probably not even thinking about, right?
Right.
Not only protects you from getting an unpleasant respiratory illness, but it actually could be saving the life of a small baby you come into contact with or an older person.
Now, is that what we commonly call it, whooping cough, pertussis?
Yeah, that's whooping cough.
Okay.
Exactly.
Just so people know. Okay.
Right.
It's interesting that to Di's point about all of the other diseases or viruses that require boosters, you don't hear as much about that. I mean, COVID really does dominate the information space right now. What could we do to do a better job, or how can we improve that so people are aware of these other things that you were talking about?
Yeah, I mean, the first is to make sure you're getting regular primary care checkups, because there are other boosters that you need when you're older, like shingles. Many people, if you're my age, you probably had chickenpox as a kid. If you're my kid's age, you got the chickenpox vaccine, which is great, but you can still develop shingles as an adult. And again, as a physician, shingles is a very, very, very painful condition. So but most people don't carry, a list of what booster do I need in my head. So having that primary care doctor who says, oh, you just turned 50, it's time for your shingles vaccination, is going to be that driver, I think, to get a lot of people vaccinated and to help you arrange it and maybe even get it in their office. So having a primary care physician that you can be connected to, or even a pharmacist or whatever your provider is, they're going to help keep you on track. Just like if you have kids, your kid's pediatrician kept you on track. Every time you brought the kid in for a checkup, they'd say, oh, it's time for her, X, Y, and Z vaccine. And so having a partner who's going to remind you and help you get the vaccinations is really the best way.
And time gets away from us, Clay. It sure does. And when you talk about, everybody realizes and knows about the childhood vaccine, the series and all that, but as we age and as we're reasonably healthy, it's, for the longest time I thought, oh, I don't need any more shots. And all of a sudden it dawns on you as you age and get older.
Sure.
Yeah, you got to protect yourself. And it's the doctor's point here too. You're protecting other people. You're protecting your loved ones, your family, your friends.
That's what I was thinking about. It isn't just about the individual. It's everyone around you, because you don't want to, and as Dr. Avegno has referenced a few times, you could pass this on to a child or an elderly person or a coworker or somebody you encounter on an airplane. So it really is just about being a good citizen to think, look, I'm going to take care of myself, but not pass something on to someone else.
Yeah, I mean, that's what public health is, right? It's protecting all of us by doing very simple measures. We don't dump our garbage onto somebody else's lawn because that would make them sick, right? So we've developed a system so our garbage can be taken care of. It's the same with a vaccine, right? I do not want to infect my loved ones who might be at high risk. So I'm just going to do this very simple thing. And the extra bonus is that it protects me too.
Absolutely. Someone who would be listening today, Dr. Avegno, and they're not sure, well, how long has it been since I've had the tetanus shot, or did I have the pertussis? And how you can just, it's very simple. Just call your primary care physician, call the office, or just run by, because they have the list. They have it in your chart. It's going to be real easy for them to say, yeah, you're good, or nope, be a good idea. I mean, it's real easy to get access to the dates that you need to know.
The Louisiana Department of Health has a great immunization system. My office at the health department takes calls all day long about, I need shot records and that sort of thing. And,
right.
And again, your primary care doc, I know that my kids always are nervous when they go to the doctor because they know their doctor is going to pull up that shot record and say, oh, yep, you're not getting out of it today. Right.
And, and I really do appreciate what we have, on our phones, our cell phones these days, the Louisiana wallet.
Yeah.
That is fabulous. All you do is show your history of your COVID, your vaccine, your boosters. You are good to go.
Yep.
That is, I don't know who came up with that, but many thanks.
Louisiana Department of Health. And I will
God bless you for doing that. Wow.
Places. Oh no, that's my colleagues.
Gosh, yes.
Sokol and Dr. Cantor. And we are one of the few states that did that.
That's
and
right.
It just makes life
so much easier. You are right.
And it evolved. It was intended to be something else. And then the pandemic hit.
It's your driver's license.
That's exactly right. It was supposed to be for the driver's license. And
I didn't realize that.
Listen, what is it? Necessity is the mother of all learning.
Oh, no,
so I think for us talking about that particular thing, I'm glad you brought that up. I do believe it's important for us to be aware. And I don't want to belabor the point, but I do think, Doc, telling people, look, if you don't know right now where you stand on the spectrum of boosters and shots, it is a good idea to just schedule time to check that out, right?
Oh, absolutely. And again, if you have a trusted healthcare provider, that's really the way to go. If you don't, you can find one. There's lots and lots of primary care physicians, nurse practitioners who would love to have this conversation with you.
And it is a conversation, and it behooves everyone just to be on the same page and to know, because when you're healthy, you don't need to go in and take their time. Not there's anything, because that's what you all do. But again, as Clay said, not to belabor the point, you want to stay as healthy. You want to stay away from the doctor. You'd like to go in and say, hey, nice to see you. Have a nice holiday season. But I really don't want to see you unless I see you out to dinner or at a party. I don't want to be in your office because you want to stay healthy and make sure the doctor's healthy as well.
Listen, I do an annual, so I don't have to see my doctor more.
Yeah. And you do like him. We like our doctors, but it's just like, hey, it's good because when we need to see them,
the doctor you really don't want to see is me in the emergency department.
Right.
Amen to that.
Then something bad has really happened. Yes. So see the doctor that you like when you're feeling well, so you don't have to see me.
And that you're comfortable with too. You want that
Exactly.
conversation.
Well, talk about, Doc, My IR, the mobile program that exists right now.
The My IR.
For being able to register to access immunization records.
Oh, so actually that is something that I think is run through LDH. And I think is relatively new.
Yeah.
But I tell you, it's a lifesaver because if you're like me and it's the day before school starts, and you realize you haven't filled out the immunization form.
Scramble to get them.
Yeah.
Exactly. So it seems like this is going to be a really good way, again, for the public just to have access, just to know what their kids, where their kids are, where they are. So just one more way that the public can be on top of their health.
And how to access that easily,
That's
too.
Right. That's right. I mean, technology does serve a great purpose when it comes to things like that. Records you can collate, keep together on your phone. And as you referenced, the Louisiana wallet, which is a lifesaver for so many things. Yeah. And it's great. So for you, Doc, when it comes to technology like that, are you encouraging patients or people that you encounter to certain areas to get information?
Well, certainly, the gold standard for information about vaccines, vaccine preventable diseases, viruses, all that, of course, for us here in the U.S. is the CDC. I mean, there's a page for every disease, and I have used them because, we get a lot of strange things coming through the ER. So whether it's brucellosis or the flu, there's a lot of really good, well-written basic information. Louisiana Department of Health has some really good information. At the New Orleans Health Department, we have good information. I think the key, though, is to stick to trusted sources.
Absolutely. Yes.
Your mom's aunt's cousin's neighbor might be a really smart guy, but they don't necessarily have the years of expertise and have really thought about developing educational materials about a particular vaccine
or a medical degree
or a medical degree, right? So while, social media, I think, is good for creating awareness and encouraging discussion and dialogue, it's really not where you should be going for real practical medical knowledge. You want to stick with places that are verified. And your provider might have some recommendations. They might say, oh, like there's this website that I really use that I send all my patients to. It's got really good information about this. So really you've got to stick with those that you trust.
Because we don't want that misinformation. That's what we've talked about so much on the podcast.
Right.
So much social media, so much misinformation. That's one of those catch-22s. You think that you've gone so far with getting the right information out about COVID, about vaccines, about boosters, whatever. And then you take 3 steps back because somebody, like you said, hears from Billy Joe's mama's daddy's brother and that it's not the right thing. And we don't want to do that.
And it's deadly. Quite
it is. Yes, it is.
Watched the results of people dying because they were misinformed. And I would never want that for anyone.
No.
Doc, if we left anything out, is there anything we haven't covered about getting boosters? Who should get them? How soon?
Yeah, I think, again, now is the time. If you want to have the safest, healthiest season that you can, knowing that everybody's going to be going out to parties, and it's COVID and flu, and you can get them on the same day if you want to get them on the same day. You can get them on different days if you want to get them on different days, but just get them because no matter what, they're going to reduce your chance of getting the virus. But, we know that even if you do get the virus, if you have that booster, you are going to have a much, much easier time with it compared to folks who did not. But, there are other viruses out there. So you still want to keep in the back of your mind, if I'm going to a huge party in the height of winter and everybody at work is sick, I could still put on a mask, right? I could still take precautions. If I'm not feeling well, I'm going to skip this one, right? Because we all have a small role to play. So we can't forget we have so many things in our toolbox now that we didn't have at the beginning of the pandemic.
Right.
Vaccines are critical and they're important, but we also can't forget the other things.
And, I'm a list maker. I like to make a list. And when you put that, your personal health, what you need to do to make sure that you do have a successful fall and winter season, you get your shots, you talk to your doctor, whatever, you feel so empowered, Dr. Avegno, when you can check it off. I've done that. And then you don't have to think about it anymore, Clay.
That's right.
It's done. It's
That's
done
right.
and done. It's behind you. And you're doing the best you can to stay proactive about your health.
Yeah, I'll tell you, my family, we went on a weekend trip to New York a few weeks ago. And so I made sure we got, all of our vaccines 2 weeks before we went. And I felt so good while I was there because it was bustling. It was crowded. The subways were packed. But I thought, I have prepared. We are ready for this. We're all healthy. We're boosted, and we had a really great time because of that. If I hadn't, I would have been really nervous about getting onto a subway train with 50 other people all around me.
All right, ladies and gentlemen, Dr. Jennifer Avegno. We appreciate the time, Doc. You've been so amazing, and the information has been wonderful.
Well, thanks. It's been great to be with y'all this morning.
Thank you, Doctor. We appreciate you so very much.
Well, again, Dr. Avegno, we thank you so much for being on with us. And listen, ladies and gentlemen, if you would like to learn more about My IR Mobile and how you can access your immunization records online at any time and for free, visit myirmobile.com. That's myirmobile.com. And thanks again for listening to another edition of Vax Matters.